Hi, and welcome to the presentation of our paper, LATIOS. We're looking at the problem of telemonitoring, where latency can cause overshoots and irreversible damage to the patient. At the same time, the surgeon is dealing with increased cognitive load and a loss of depth perception by looking on the screen. Our approach? LATIOS, Latency Aware Telemonitoring for injection in ophthalmic surgery. On this slide, we can see the system overview with the operator sitting in Canada using the haptic input device connected to the operator PC. That's where we are using the motion scaling algorithm to generate the command for the robot. This command is sent by ROS to 0 tier to Germany, where the robot is executing the task on the eye phantom. A microscope with a camera attached on it are looking on the eye phantom. All of these things are connected to the robot PC, where we're using shadow-based depth estimation, data logging, and a force sensor is attached to the robot. All of this data is sent back to Canada, where the surgeon can see the most important information on a GUI. Our motion scaling algorithm works like this. We're scaling the motion in the Z direction dependent on the latency in communication and the tip-to-retina distance, which means a higher latency and a lower tip-to-retina distance both lead to a lower motion scaling. Additionally, the equation considers the time the motors need to stop and the reaction time of the user. To validate our approach, we conducted a user study with 2 surgeons, 2 medical students and 2 non-medical students, where the task was to touch the retina at 4 different circles, where we added delay for circle 3 and 4. We tried 3 different setups: constant scaling, linear scaling and LATIOS. The metrics we collected were punctuation force, task completion time and NASA TLX. On the right side you can see the GUI the user in Canada was looking at. Here you can see an example of the raw data captured by our force sensor, which we use to detect the retina touches for one subject. Here we have the results. On the left side you can see a significant decrease of punctuation force when using LATIOS and a decreased variance when using our approach LATIOS. On the right side you can see a significant increase of task completion time when using LATIOS or linear scaling. Looking on the left side, you can see how higher delay barely increases the punctuation force for LATIOS only, with negative effects on the task completion time. On the right side, you can see the data for the NASA TLX with trends but no statistical significance. Here you can see one of the surgeons performing the user study. Note the increase in delay for circle 3 and 4.